Today I want to talk about wrist fractures, how they happen and why they happen. The wrist fracture can happen to any age population, from the children to the elderly people. It's one of the most common fracture in the elderly population because of the quality of the bone is less strong than a younger population. It's still happening in younger population who doing some gymnastics or skiing or bicycling. When they fall an outstretched arm, they try to protect from the fall. Usually they put the arm out, and that's when the fracture of the wrist happens, as well as fracture of the elbow. In elderly population, even small fall, when the elderly people try to protect themselves from the impact, they have a wrist fracture. There is several types of wrist fracture exist. There is not all the wrist fracture have to be treated with surgery. However, if the anatomy is severely distorted after the fall, for that type of fracture, we preserve surgical treatment. There is a intra and extra articular fracture. So there is a type of break that going through your joint and that type of break that does not involve articular surface of your joint. If the break does not involve articular surface of the joint and it can be anatomically reduced, so what's the reduction? We give local anesthetic. It's in an emergency room in the office. We manipulate the wrist and we try to put him back in an anatomical position. That type of fracture can be treated non-operatively. We immobilize it in a cast, and patient have to be in a cast about 5 to 6 weeks, and then cast remove and patient start physical therapy. If the fracture distort anatomy of the joint, and what's the distort anatomy? When the wrist becomes shorter. When the wrist becomes shorter, we have a lot of tendons in our hand. If the wrist is shorter, then tendon losing their rigidity, and they cannot be as strong, because once you try to make a grip, because our wrist is shorter, you cannot grip the same like you're gripping when your bone is longer. That type of fracture usually requires surgical fixation to bring the bone back to normal anatomical length and to restore the articular surface of the joint. The surgery is it's not a very extensive surgery. It's a very small incision, and usually there is a metal plate that keep the joint in anatomical alignment. After surgery, patient have to go with casting again, but it's less casting because there is actually something inside your wrist that holding the bone together. Usually about 3 to 4 weeks casting, and then again extensive physical therapy from 6 to 8 weeks. Most of the people recover almost 100% after that type of injury. Of course, there is always non-surgical candidate. If there is a very elderly people, have a lot of comorbidity, even that the fracture has a lot of deformity and intra-articular surfaces involved, patient elderly and does not perform so many activity with their arms, we still leave this patient non-surgically and treat them in casting and physical therapy.